really our key messages will be focused around introducing digital health in Canada. And as a national not-for-profit association, Digital Health Canada really presents a unique vantage point. And part of what we'd like to do today as well is help you to think about your own personal vantage point as students and as leaders in this space, how to expand your vision and think about your network, your learning, and your connections in the field of digital health, both locally in your jurisdictions as well as nationally. And ultimately helping you to drive your own learning process as well as our industry forward together. On our first set of slides, really one of the key points we have listed is a discussion about digital health. What does it mean to you? And we often kick off a session with graduate student leaders like yourself in terms of understanding more about where you see the definitions and connection points in digital health. Ultimately, digital health is a convergence, and that's one of the reasons why it's such an exciting field for us, full of innovation and full of opportunity, because it does connect health and healthcare, citizens and clinicians, technology and information to make the delivery of health services more efficient, more effective, more personalized. The other excellent part about digital health, and one of the reasons why it's such an amazing career area for you, is the fact that it truly is a multidisciplinary domain. And by that, I mean there is a huge array of stakeholders, professionally prepared in terms of clinicians, engineers, researchers, scientists, academics, and entrepreneurs, all coming together that represent a very wide range of expertise across many of the domains of data management, health sciences, public health, health economics, and social sciences. These individuals ultimately help us to bring together a huge array of digital health technologies, from personal health records to virtual health tools and services, wearables, home monitoring technologies, clinical information systems, referral tools, and increasingly personal health resources, as well as artificial intelligence technologies. And those technologies, those people, and those processes come together to really drive the future and the implementation of digital health in Canada. And our mission and vision as a national not-for-profit association, made up of over 5,000 individual members, just like yourselves, professionals, students, emerging professionals, all the way to executives across the country. We set out to catalyze the digital health community together. All those domains I talked about, all those sectors and subsectors that are collaborating and working in order to bring to citizens technologies that can improve health. Data sets, as Eric just referred to, that can help to enhance the planning and system design and delivery of health services across our country. And our mission at Digital Health Canada is to connect, inspire, and empower those professionals. We do that by connecting through events, conferences, the National eHealth Conference, regional events. In the coming week, we've got an exciting job fair for students across the country that will be occurring. And we build relationships and collaborative partnerships with organizations and members across the country. Nickiesha is going to talk about some of the empowerment work we do in terms of knowledge sharing, learning and credentialing, the professional development journey that our members take on, and some of the key resources that assist in driving that forward. And ultimately, we look to our members, professionals in this community, to inspire each other, to be visionary, transformative, and help to share thought leadership and ideas that drive the entire community ahead together. Our next slide introduces our strategic priorities. We're just wrapping up our 2023 strategy, and our board of directors this year will be actively working to develop our next strategic plan that'll drive us forward. As an association working to represent the interests of emerging professionals, professionals in the middle of their career, as well as executives across Canada. We have three pillars. One is around empowering each individual to have an outstanding network that can help them in their own professional journey. Another pillar and priority is focused on the knowledge sharing and lifelong learning by being first in choice for our members who are looking to build on their professional development journey. And our final priority is focused on the industry itself, representing the interests of all of our members in terms of advocating for digital health professionals and health informaticians, as well as advancing each sector and the collaborations between sectors. Our member ecosystem on the next slide gives you a sense of the types and breadth of organizations that are involved in working together. And one of the key messages for you as students that are moving into this realm, studying in key areas, driving the future set of knowledge forward, is really to think about expanding your network and envisioning all the areas where health data touches across different organizations, from health service delivery standpoint, whether it be academic medical centers, community hospitals, home care delivery, primary care, all the way into the workplace through virtual services that may be delivered by organizations covered through insurance, as well as into the private sector, retail outlets, companies that develop personal devices and tools for tracking and managing health that citizens are involved with. And of course, many organizations that are connecting the data sharing and the experience of consumers and patients across all of these organizations. The next slide shows you a sense of the digital health journey that is in play. And this is a slide from Gartner that really helps you to align and identify where it is that you're focused in your own work and where you may want to look for collaborators and build your network of partners in other areas. You can see those arrows moving across the health journey on a continuum from health all the way into healthcare and disease management and rehabilitation, possibly beyond the health services environment. And the many IT domains that exist to support and revolve around that individual's health journey at a population focused level. The next slide shares with you some of the key areas or challenges that our members bring forward. As an association, we do get to hear from a very broad array of member sectors and segments, as well as professionals. And for 2022, the three core focal areas that we hear challenges in are continued pandemic response, planning for the fall and winter, and potential new waves that may evolve, the continued public health challenges that exist for vaccination and prevention. We have a huge array of activity involved in integration and infrastructure because of the speed and pace of implementation of new technologies and innovation through the past 2 years. There's a lot of work underway at this point to ensure that the processes, standards, from a practice standpoint, as well as a technology standpoint, are in place to be able to share the information that is being collected. And the pandemic has continued to shine a spotlight on the existing healthcare human resources challenge that exists across our workforce. Our members recently published through Digital Health Canada's publishing and through a workshop we held in the winter, a thought leadership paper on automation and the use of automated resources, tools in healthcare to help to assist and address the challenges brought on by the healthcare human resources challenges at play. The next slide identifies in more detail some of these key areas and themes, many of which you're studying in your day-to-day work, whether it be around the continued implementation of virtual health, challenges and opportunities around digital literacy and equity that have stood out. We've had a number of cybersecurity issues that have taken hold across the country, challenges with regards to protection of data integration, data management, that has brought to light a whole set of resources and new work that's required in that space. A broadening focus on our mental health opportunities using digital tools, data, and virtual services, as well as you heard Eric talk about all of the work around acceleration of data collection, data integration, and data that's helping to drive the digital transformation across the country. So those are some of the key themes. I'm going to pass it to my colleague, Nickiesha, who's going to share with you some of the opportunities in our professional development space that are helping professionals and students just like yourselves as you embark on your learning journey. Nickiesha, over to you.
Thanks, Mark. I'd also like to express my appreciation for the opportunity to share at VADA Summer School 2022. So here at Digital Health Canada, as Mark mentioned, one of our priority areas is knowledge sharing and lifelong learning. As lifelong learners, we believe you're self-motivated and you continue to invest the extra time for learning, which brings its own personal and professional rewards. We play our part here at Digital Health Canada by providing the resources needed to encourage a mindset of never stop learning in the digital health in Canada landscape. We do this by creating a learning culture in our association. A few of the ways we create this culture of lifelong learning here at Digital Health Canada are, by one, empowering our members with goal setting and networking. We do this by offering regular internal learning opportunities that empower our members as they set professional goals and network with individuals at different levels of their career. For example, we partner with HIMSS USA to grant the CP HIMSS CA credential, which stands for the Certified Professional in Healthcare Information and Management Systems Canada. This credential acknowledges experience and knowledge in health informatics internationally, but also with a more in-depth Canadian perspective. Next slide, please. We also create a culture of learning by empowering our members and individuals with professional resources. By guiding our members to approved learning resources that align with the core health informatics competencies. These approved CEPs, continuing education providers, offers free and paid content that are accessible via our website on our learning management system. Next slide. Some of these resources are also developed in-house by our volunteers. These include our career matrix, which allows an individual to chart their career goals or journey with the help of the HIP roles and profiles document, and I'll share the link for these resources in the chat. The career matrix is available via our website and identifies professional opportunities in specific domains in health informatics, in the health informatics space. Next slide, please. We also provide opportunities for our members to shine in volunteer roles, and we celebrate them by acknowledging their successes. As you can see on this slide, these are some of the opportunities that are available for you, anyone with an interest in digital health in Canada. We're constantly exploring ways to give access to our learning assets. Today, this is done via our LMS and our resource library that houses papers, reports, and recordings. We are happy to play our part in knowledge sharing and lifelong learning for anyone with an interest in digital health in Canada. Over to you, Mark.
Well, thanks very much for that, Nickiesha. We are very pleased to look forward to engaging with you all as members of the association and as leaders and future leaders for our industry here in Canada. Our final slide, I think, has some contact information for you to reach out and engage. And with that, on behalf of Nickiesha and myself, we'll say thanks to the organizers here at the VADA Summer School for inviting us to share more about Digital Health Canada with you today. Thank you.